Hi there, my name is Suzy. I will be your student practical nurse today. I understand you're here for an assessment.
Yeah.
Yeah, okay. Can I just get your name and date of birth, please? I'm just going to cross-reference that with your ID bracelet.
Sam Nemes, Jan 1083.
Okay. All right, so I'm going to do an assessment, and that includes checking your hands and your nails and checking your head and your neck and your face. It'll include some palpating and some observing. Are you okay with that?
I am.
Okay, I'll just give us some privacy, and then I will wash my hands. And I will start with checking your hands, and I'm going to just check the color on your hands and the warmth. And I notice they're both warm, and I notice that they're both bilaterally pink. And if I blanch them, the color comes back pretty quick. And I'm just going to check your capillary refill as well on this middle finger here. And if I check that, the color comes back within 2 seconds on both sides. And I'm noting that there is no lesions on your skin except this one here. That cat scratched you. Okay. And there's no inflammation in your joints or anywhere else. And I'll just turn it over and check the other side as well. And it's bilaterally pink, no inflammation, no lesions, no bruising. And I'll just turn it over, and I'm going to check the degree of your nail. And I notice on most of them it's about 180 degrees. This one here, it looks like it's maybe 160, but there's also some clubbing on that one as well. Are you a smoker?
I am.
Okay, I'll just make note of that. And that's all I'm going to do for your hands. And then I'm going to check your head, and I'm going to check for asymmetry. I'm going to check for any bumps or lesions. I'm going to check for infestation, for your cephalic shape, to make sure it's evenly round. And I'm going to check the color of your hair and the distribution of your hair and also the texture of your hair. So just let me know if any of this hurts. Okay, and we're just going to check here, and I'm not noting any lumps or bumps. And your hair is soft. It's a dirty blonde color. It's evenly distributed. And there is no infestations or lesions in there as well. And it feels to be a normal cephalic shape. I'm going to also check your ears. I'm just going to check your auricle up here. Let me know if there's any tenderness at all. And your pinna. I'm just going to check to make sure there's no inflammation or lesions. There's a little mark there. I'm just going to note that down. And I'm going to check this side and note that they are both pink bilaterally, and there's no inflammation or swelling or lesions or bruising. Then I'm going to check your temporal artery and just let me know if this is tender. Okay, and I'm noticing that there is no inflammation here, and it feels good, so that's good. Then I'm going to check your temporal mandibular joint, and to do that, I'm just going to get you to open and close your mouth slowly. Okay, and if you can move side to side as well. Okay, and if you can just clench your mouth. All right, so I didn't notice that there was any asymmetry. I didn't notice that there's any popping or grinding, so I think your jaw is okay. Then I'm going to check your nose, and I'm going to check your maxillary sinuses. Just going to palpate that. And I don't note any inflammation or erythema there. And I'm going to check your frontal sinuses as well. Again, there's no inflammation or erythema. Was that painful at all?
Nope.
Okay. And I'm just going to check the symmetry of your nose again and note that it's symmetrical. And then I'm going to check the patency of your nose. So if you can just close one of your nostrils and then breathe out of the other one. And do the same thing with the other side. Okay, and did you have any difficulties breathing at all?
Nope.
Okay. Then I'm going to check your mouth. I'm going to check the outside first to make sure that there's no dryness or cracked lips or bruising again. Make sure there's no domestic violence in your life. Nobody's hurt you. It's a safe place. And then I'm going to also check, and I'm noting that there's no dryness. It's moist from the outside. It tells me that you're hydrated. There's no inflammation or bruising or lesions or cracks. And I'm going to check the inside of your mouth. You can just pull your bottom lip out, and in here I'm going to check for moisture. I'm going to check your teeth to make sure they're all there. I'm going to check to see the color of your gums and check your buccal mucosa for that as well. Just a few cookie crumbs. And then if you can just check the top. Okay, I'm going to check the same thing at the top, and I'm noting again that all of his teeth are there. And if you can just open your mouth and stick out your tongue and say ah, I'm going to check your buccal mucosa, as well as your hard and soft palate and your pharyngeal wall. And I'm going to check for moisture, discoloration, any inflammation, erythema. If you can just open your mouth and to stick out your tongue and say ah. Okay, that looks good. It's moist in there. There's no cracks. There's no inflammation or redness. I'm also then going to go and check your lymph nodes along your cervical chain, and that will start at the top, by the top of your ears, and I'll work my way down your neck into your clavicle here. So just let me know at any point if there's any discomfort. Okay, we're going to check your preauricular lymph node here, and your postauricular, and your occipital, and your jugulogastric, submandibular, submental, and then we're going to look at your superficial cervical lymph node, and then we're going to check behind your sternomastoid muscle, and we're going to go along there and just palpate along the cervical chain, and then again at the front of that muscle as well. And I'm not noting any inflammation. Was that tender at all?
No.
Okay, I'm just going to check your posterior cervical lymph node in here. Just going to palpate that, and there's no inflammation or hardness in there either. If you could just raise your shoulders a little bit for me, and I'm just going to go in here and check your supraclavicular lymph node, and you can put it down. Was that tender at all?
No.
Okay, and I'm just going to note there was, again, no inflammation or hard lumps. So that was good. Now I'm going to check your carotid on both sides, and I'm just going to check this side first. And that's a +2 on that side, and then I'm going to check this side. And again, that's a +2 on that side. If you could just lift up your chin a little bit, I'm going to check your trachea and just confirm that it's in the midline of your sternum here, which it is. Okay, and then I'm going to check your turgor, and I'm just going to pinch your skin a little bit, won't hurt, and I'm just checking for elasticity and mobility. So if I pull it up, I notice that it pulls up with ease, and it also rebounds quickly so that your turgor is okay. I believe this concludes our assessment. Do you have any questions?
No.
Okay. I'm just going to wash my hands one more time. I'm going to note down your nails, and I'm just going to also note down that I didn't see any irregularities on your skin, no bruising, no erythema, no dryness or over too much sweating, and that I'll let the doctor know. Thank you.